Let's talk about this animal metronidazole, aka Flagyl. A very, very bitter medication. It smells bad, and sometimes we think that is the hospital. When you see that drug, that is a sign of the hospital, right? It's a very, very bad smelling drug, but it's called metronidazole, the generic name. So doctors are supposed to prescribe using metronidazole, not Flagyl. Flagyl is a brand name. Okay, so this drug is actually an antibiotic, targets all those microorganisms that we mentioned, the Gordonella, and also the Trichomonas. So it's a very good drug for vaginal infections. But most of you don't finish the dose. And the trick about this is, remember, this is a drug of choice. So if you don't clear the dose for the Flagyl, so when you have that disease, it's difficult for you not to take the drugs. You'll have to. When they are prescribed, take it completely. Why? Because if you don't, and then you end up getting resistance, thank God the resistance is very limited. But if you end up getting resistance from that medication, now we'll get to prescribe you more expensive drugs which have even more side effects. Okay? Yeah. So those of you who take it and don't finish it, please, please do it. Okay. So yes, this is an antibiotic which basically targets protozoa, targets amoeba, and the bacteria. But this drug, the side effects, the metallic taste, after taking it, the next day you're feeling like you're eating a metal. Your mouth is full of that metallic taste, the nausea and vomiting. You feel like, I cannot even eat, no appetite because of the news that is coming back. Also, this drug comes with side effects that are called the disulfiram-like effects. Disulfiram. Disulfiram is a drug that when you take, you get hangovers for 3 days. So the reason why people are told don't take metronidazole with alcohol is because if you're going to take that, imagine, and again, people who get these conditions get it through the weekend, right? The one that is sexually transmitted. So you get it through the weekend, and then you've been drinking through the weekend. You're diagnosed with during the weekend. You're given metronidazole, but you don't tell your doctor you are a drunkard nor you drank alcohol, or you're going to you're going to take a glass to just make sure that your hangovers are going down. You'll get into problems. Why? Because this drug will give you a hangover for 3 days. You'll have hot flashes. The face is just burning. You'll have nausea for 3 days consecutive. You'll have rashes on your body. You'll have abdominal upsets that are crazy. The fevers, super high fevers because of the alcohol. When you get that, when you see a bottle of alcohol, you use the next exit. You will run away from alcohol. That's why it was actually being taught. It can actually be used for people who are drunkards and alcoholics to just make sure that they don't think about alcohol ever again. But you see, if somebody is already at an alcoholic state, if you give them this medication, you will destroy them, you will kill them. So that was a very evil thought. Okay, yeah, there are ways that you can actually talk or motivate people who are alcoholics to get out of there. And we said one of that method is not to take them into a rehab center where there are more alcoholics. Because imagine that. Imagine your father or your uncle or your brother is an alcoholic, and then you drag them into a rehab center where there are more alcoholics. But we know very well for us to change a behavior, we must substitute that behavior with a healthy behavior. And then we must change the environment. So imagine you change the environment for this guy. You took him away from his friends, yes, but you put him in another area where there are more drunkards. So how do you expect this drunkard to come out of his drunkardness? And then you're now pumping him alcohol in low doses and all that, trying to help him. But you'll be thinking, I'm even better off than this guy. Why did they bring me here when this guy is actually more alcoholic than I am? Let me talk about the PID, pelvic inflammatory disease. PID. What is PID? From the word is pelvic inflammatory. Again, do not ever forget the word inflammation, inflammatory. So it's either ending with TIS or it's just like this one. They've named it inflammatory disease. Don't ever forget that. Inflammation is coming from the kitchen. 70% of inflammation is coming from the kitchen. The wheat, the seed oils, the sugars, the pasteurized milk, the processed foods that are fortified. That is where inflammation is coming from. So if you drop those foods, your inflammation is disappearing. Not dropping red meat and still consuming seed oils. Not dropping red meat and still being served with sausages in the morning. It's a waste of time, okay? So if you've ever been diagnosed with PID, it's time for you to, actually it's a red sign that, hey, drop that seed oil, drop that wheat product. And you know all of us are so addicted to the wheat. We are either in a birthday eating a cake, which is a combination of sugar, wheat, and milk. So sugar, wheat, milk, and seed oils also. We are eating chapati, and then we are saying it's brown chapati. It's still wheat. Your body does not know colors. You're taking sugar in form of fruits and saying, you know, I dropped sugar, but you're taking honey. When you're using that concoction of yours, you're sitting in Java taking that dawa, and that dawa you add in a lot of honey. So those waiters at Java know, this one does not take out. Daktari warned you against this. They bring you the honey, and now you're busy pouring that honey in your dawa, and now you're waiting to lose weight. The weight is still there. You go and step on a weighing scale tomorrow in the morning, is now even up by 1 kg. You're like, yeah, but I've been taking dawa. No, you've been taking sugar, just adding up on the storage. Okay, so yes, PID is an infection of the upper part of the female reproductive system. Now, inside that part, that reproductive system, we have the vagina going in, and then we have the cervix, and then we have the uterus, and then we have the fallopian tubes and the ovaries. From the uterus up to the fallopian tubes and to the ovaries, that is the upper part of the reproductive system of a woman. Okay, and that's where PID affects. Sometimes, of course, it spreads from the vagina into that place. Now, the most annoying part about this disease is when you leave it unattended to, most women don't even experience the symptoms. So when you leave it unattended, guess what is going to happen? We are going to form pus in the ovaries or in the fallopian tubes. And when you form that pus, where is this pus coming from? Remember, it's an inflammatory disease. Can be caused by the diseases, infections like gonorrhea and syphilis and all that. That media station that okay, it can be caused by basically trauma. Some surgical procedures can actually introduce bacteria which will cause you the PID. That got me shocked. Okay, that you do a surgery and then, of course, most people die from botched surgeries. Most people die in the theaters. So you do a surgery and then it's an aseptic technique, but now you do it and then you introduce bacteria into the upper part of the reproductive health system of a woman, and then you cause PID. And ladies who have suffered PID know sex is not an option. But some of them will confuse PID with endometriosis. They don't even know the difference, okay? Because they've not been told. But when you are empowered with information, it becomes easier for you. So you have the uterus, you have the ovaries, and the fallopian tubes being infected or being inflamed. Now, one of the complications of this PID is actually infertility. So ladies, if you've been diagnosed with this once, it's time for you to change everything, okay? Because infertility is coming in. Why? Because when you have these infections coming into the, let's say, the fallopian tubes, where fertilization is supposed to take place, they cause inflammation. And when you cause inflammation, what happens is the system sends immune cells, white blood cells there, to go and fight the inflammation. And when the immune cells come there, they start causing a lot of fluid retention. And you see, it's a natural way of the body trying to maintain the balance, right? But it has sent the immune cells towards the ovaries, towards the fallopian tubes. And these immune cells are coming in to just destroy this inflammation or this infection. And during that process, we start producing pus. When you produce pus, some of these pus will accumulate in these fallopian tubes, blocking them. Okay? And you see, where there's pus, we call it an abscess. So this will mean now it's a complicated one. You have to go for a surgery to remove the abscess. So when you start the healing process, anytime you have a healing process, there must be a scar. So you can end up forming scars in the fallopian tubes. When you form these scars actually affect the flow of the egg from the ovaries into the uterus. And that can actually cause you either infertility, or it can actually cause you blockage of these fallopian tubes that will actually predispose you to ectopic pregnancies. You know very well how painful ectopic pregnancy is. For those of you who don't know what ectopic pregnancy is basically having an egg that is already fertilized, implanting in the fallopian tube. It is supposed to implant in the uterus, but now it has stuck in the fallopian tubes, and now the fetus is growing in the fallopian tubes. Some can actually burst. It is a very painful experience, and it requires some surgery. And you see, by the time we are diagnosing you of that, it's already too late. Okay, so this condition is a dangerous one. It will actually lead you to a lot of complications, one of them being infertility. Okay, so if you're a younger lady, you ever been diagnosed with this, please Start changing your kitchen. Start eating healthy and living a healthy life. Also, start looking at who you are having sex with. Wear a condom. Can it be reversed? Yes, it can be reversed. The condition is easily reversible. It actually can be treated because you see it's caused by something. So you simply treat what is causing it. But if, let's say, you get the busted fallopian tubes, that becomes a serious problem, right? Yeah, so don't overthink it. Simply stay within that range where you are right now. Start fixing what you have to fix right now to prevent the occurrences of these things. Because this is also a multi-billion-dollar industry. Now, when this inflammation or this pus is accumulating in the fallopian tubes, that is a condition that you will see a prescription or a diagnosis written as salpingitis. 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 So you will be wondering, what is this salpingitis? And your doctor will not tell you. They will not tell you. They will write, oh, don't worry, this is just a problem in the fallopian tubes. Writes drugs. Tells you, oh, no, 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 no. This one is an emergency. You need to go for a surgery. Right, sir? More lab tests and more ultrasounds. Go and spend money, then come back, book. We'll book you for surgery. Okay, so some of these medical terms are supposed to scare you so that they maintain their monopoly. So it's called salpingitis. If it's happening in the ovaries, we call it salpingo or ophritis. Ophritis is double O Phritis. So either ophritis or salpingo. When you see these things, salpingo or salpingitis, just understand it's an inflammation that is happening in the fallopian tube. Salpingitis, fallopian tubes, and therefore we have a lot of pus and abscess there. If it's happening in the ovaries, that is what called the salpingo or ophritis. Hey, I feel like somebody who can stamp some authority. When I say ophritis, imagine you're seated there and I'm telling you, you know you have ophritis. You're like, Daktari, what? Then I'm telling you, no, don't worry. I got you. I am your gyna, right? I am your gyna. I got you. So now surgery. So again, PID is caused by some of the bacteria that actually can expose you to PID. One is Neisseria gonorrhea in that media station. Number two is Chlamydia trachomatis. That is basically what you call the chlamydia. And then other bacteria that can induce this, and where do they come from? This bacteria can come from an abortion. When you get that abortion, you get an infection, you can actually cause yourself a PID. Also surgeries, the botched surgeries, and also vaginal childbirth. The normal birth, when you're giving birth, you can get exposure to bacteria that can actually beat the cervical mucus and then enter into the uterus and up there start causing you inflammation. But God designed the vagina and the reproductive health system very perfectly. He actually put mucus at the cervix to protect you from getting these microorganisms going into the child's house, the uterus. But all of us are struggling to actually destroy that mucus through hormonal contraceptives again, through the GMO products, through the skin products, through chemicals that we use, through what we call that thing, the tampon. So all this can actually mess up the concentration of the mucus around the cervical area. And then they allow bacteria that are just coming in and going up there to cause you inflammation, which is the PID. And this is a very painful experience. Okay? Yes. And then, what are the symptoms of this? So I'll read to you the symptoms. One, some women express no symptoms at all. Of course, that is true. But most of them will experience the pelvic pain, pain around the fallopian tubes and the ovaries, a lot of fever. And then, of course, there are sometimes you get recurrent infections and you're wondering, what is happening? This is coming in handy. Of course, abdominal and vaginal discharge, and then very painful sex. So now you start blaming your partner. You start saying, I hate sex. But this is the problem. Okay? Good. And then how do we treat this? Of course, antibiotics are there. And you know antibiotics are actually going to cause you more problems. But when you are here already, there's nothing we can do. We have to put you through an antibiotic therapy. And every time you finish an antibiotic therapy, please go and take what? Fermented cabbage or fermented milk without sugar or any probiotic. Some pharmacies sell probiotics. You can go and buy and actually dilute that and drink it. But the best probiotics are you make fermented cabbage for yourself. You can make fermented milk without adding sugar and without boiling it. You can do kefir. All these are very important probiotics after taking an antibiotic therapy. And this can involve injections and then a prolonged period of antibiotics for about 14 days. So you see, when you're taking antibiotics for 10 to 14 days, That means the exposure is high. Okay, and then of course analgesics, the painkillers. And again, we talked about the painkillers and their effects. But again, when you're here, you cannot do anything about it. You have to take them for a short period of time and then fix yourself. And then if there are abscesses and the complications and the ectopic pregnancies, of course, surgery will have to come in as the last option. But most times, people prefer surgery as the first option, right? So prefer surgery is coming in as an emergency mechanism or alternative, and that has to be the last one on this list. So and then just taking care of the vaginal environment and the reproductive health system. One, yes, paracetamol can be used as a painkiller. So one, diet is important, and I'm saying about diet all through. Protect your organ by protecting your gut. Start there. Number two, hygiene. Hygiene. Please utilize cotton underwear that can actually take in the water without making it a filthy environment, the fluid without making that place a filthy environment. So invest in cotton underwear. Air these undies in the sun. The sun is a natural sterilizing agent. Air them in the sun so that they can actually dry. Do not put a towel on top of them. I mean, it's not something new to people. They already know. So air them out in the sun. Again, if you're somebody who is using water to go to the toilet, please dry the area clearly. Make it dry. Do not create a filthy environment for growth of any yeast infections and also to alter the pH of the vagina so that you get these problems. And then avoid overdressing. When I say avoid overdressing, I'm not telling you to put on those strings that you put on all the time. I'm telling you to just avoid overdressing. Don't put on a panty and then a biker and then a tight and then what? No, do not do that. You're creating a filthy environment at that area, and that is a problem. Okay, and then drop hormonal contraceptives. Let the man retain the semen or put on a condom. And remember, as you put on that contraceptive method, what you're actually targeting is you want to enjoy unprotected sex. And remember, PID is being caused by infections that are actually sexually transmitted. Also, trichomonas vaginalis is a sexually transmitted disease. So condoms are the only ones that protect you from STDs and also from pregnancy. So prioritize condoms. Number four, if we have diseases like diabetes and hypertension, reverse them by fixing the kitchen. That's why diet plays a very important role. Exercise is coming in handy. Rehydration. Now, on rehydration, I see ladies drinking water without adding salt, and then you end up urinating a lot of clear urine. That is you getting dehydrated. So every time you're drinking water, add a pinch of salt. That salt will cause you a concentrated urine. Neri, thank you. When you concentrate that urine, it will actually help you to balance the pH of the vagina. Now the system is lying to you that when you have an infection, drink a lot of water to wash out the infection. Remember this, some of these microorganisms, they have hooks, so they hook into the wall of the vagina. Urine cannot splash it out. It can't. They come with hooks as an adaptive mechanism because they know there's urine here, so they stick to the wall. So unless you concentrate urine to alter the pH so that they cannot survive, you're wasting time by drinking a lot of water. And again, this is not just a hollow tube that you just drink water and then this water goes out through the reproductive organ and you flush out the microorganisms. Do not buy that lie. Drinking a lot of water will cause you dehydration. Add some salt to hydrate adequately. And then stop using antibiotics unnecessarily. Use antibiotics when it's so necessary. Some of you get a common cold and you're busy taking amoxicillin, you're busy taking augmentin. You're wasting time, you're going to cause yourself problems. Anytime you're using an antibiotic for a specific disease, make sure after that antibiotic therapy, take a probiotic or a prebiotic, specifically fermented cabbage or kefir or fermented milk. Or you can buy a probiotic in the pharmacy, no problem. And then do not do not wash your organs with medicated soaps. Do not use douches. Do not use tampons. And I talk about tampons and people are like, you can make a lot of noise when you want to. Please continue making noise. But I put up a study that was actually very necessary on my Telegram channel that was talking about the effects of these tampons. Some ladies have actually suffered that shock that comes with those tampons. But we don't listen, do we? We don't listen. We don't want to listen. And if we listen, we ignore. Until we are whipped hard, that's when we start listening. Oh, si alisema, daktari alisema. Okay. And then, yogurt, soda, pineapples. Please stay away from these things. Soda is sugar, yogurt is sugar, pineapples are sugars. Stay away from them. IUD, I told you, IUD, not unless it's the copper IUD, but it also comes with its own problems. And there's a hormonal IUD. Run away from that one. So yes, if you're getting it too extreme, you can use copper. But remember, IUDs will not protect you from infections. When somebody tells me about natural yogurt, I ask myself, what is natural yogurt? What is this called natural yogurt? If you're talking about fermented milk without boiling and without adding sugar, maybe that's the natural yogurt. But if you're talking about a product in the supermarket that is written on natural, 100% natural, pure organic, that is deceptive marketing. Don't ever follow that path. Don't. Simply make your fermented cabbage. Fail multiple times and you learn. Some Greek yogurts are good, but you must be very keen with the ingredients. Go at the label of the ingredients. The more the ingredients, the worse the product. Okay?